Are there specific lifestyle modifications that are recommended when a semen analysis is abnormal? 100%. So I always tell patients that trying to get pregnant is like running a marathon. No one does this without preparation. And if you haven't really thought about the lifestyle modifications to make before trying to get pregnant, then you really don't know what you need to do until someone tells you. So here's the secrets to what to do. First and foremost, try to limit alcohol. We know that alcohol is terrible for the human body. Data has now come out to show that drinking can actually affect sperm function, it can also affect sexual performance, it can also affect almost every parameter of the semen analysis. So when in doubt, cut it out. Second, smoking. We all know that smoking is terrible for your body, but most importantly it's even worse for your semen parameters. Smoking causes you to have a low oxygen count within your body, or hypoxia, and also there are tons of carcinogens and toxins that are contained within the cigarettes themselves. So if you're a smoker or a drinker, please stop. Third, we talk about the heat all the time. And the heat that we're talking about is really the heat that's within your lap and the heat of the testicles themselves. The reason the testicles are contained within the scrotum is that we try to have the scrotum outside of the human body so that they can stay 1 to 2 degrees lower than the core body temperature. Because we know that ideal sperm performance and sperm maturation and growth occurs at a lower temperature. But if that temperature is elevated, that can actually lead to abnormal sperm parameters. So for example, people who wear tighty whities, people who wear tight bicycle shorts, people who do excess exercise, for example, like long bike rides, or they're doing lots of workouts in tight shorts. Those are all lifestyle modifications to consider to try to help improve the temperature of the testicles. Maybe someone's doing a lot of hot tubs or saunas. Well, they should stop that because again, that's going to elevate the temperature. But lastly, if there are some really abnormal parameters, this is why I tell someone to go see a urologist, because it's actually quite possible that despite all of your lifestyle modifications, you can't change your parameters. And that could be because you have something called a varicocele, or a vein that's on the outside of the scrotum that's elevating the temperature of the testicles. So when in doubt, go get checked out.